It's now time for On Point, where we speak to experts to delve deeper into some of the key issues in the spotlight right now. Health authorities here in the nation have decided to extend self-quarantine measures for COVID-19 patients for another 4 weeks, further delaying the country's plans to fully return to pre-pandemic normalcy.
That's right, but what are some of the concerns that prevented authorities from lifting the mandate, and what should we still watch out for at this phase of the pandemic? For this, we turn to Dr. David Kwak, assistant professor at the International Clinic at Hyang University Hospital. Dr. Kwak, good to see you once again.
Good morning. Thanks for having me.
All right, so first off, what's your assessment as a doctor on the health authorities extending this self-quarantine mandate for another 4 weeks?
Well, I think government is really trying its best to keep it in the most safest place, meaning, to my knowledge, they've run different simulations where if they lifted the mandate for once and for all, they were very close to seeing a resurgence happening back up possibly in June or possibly in July. But if they were to keep the self-quarantine for another month, that would come in about August. This is really based on the resurgences that we've also observed in many different countries around the world. In about 5th to 6th month or so after their high vaccination rate, they started to see resurgence from the previous pandemic happening, possibly due to waning of the immunity that was provided by the former vaccinations. Now implementing that theory into Korea, because many of the population within our country were vaccinated within about January to March of time, we were expected to see possible resurgence happening in June, sometime between June and September. But if we were to have lifted the mandate for self-quarantine, we were possibly seeing that much sooner than before. But if we were to keep it somewhere in between, the resurgence could also happen in somewhere in between. And I believe the government is taking the most conservative stance on this because it's much better to keep it in the safer stance rather than betting our health on something of a timely manner.
Well, as for what we can see right now, daily infections seem to be going down, virus-related deaths are also down, and the number of critically ill patients are on a downward trend as well. So what exactly remains to be concerned about at this point?
I believe what concerns our government or all other medical sector is that COVID-19 is still something relatively new that we're really facing. Even though through the different strains of it, we've noticed that mortality rate and severity rate has dropped significantly, it still doesn't mean it doesn't cause deaths any further. And there are also possibilities of new variants still happening, and having that a possibility, we cannot really let go of all our guards. So to keep this virus from spreading is really not the safest idea. More so, if it was to happen in a resurgence in a massive manner, it can cause a very unexpected and unforeseen deaths and severe forms of the disease. So that's definitely something we do not want. So, and also having kept the self-quarantine measure for quite a while, I think government is figuring that it is safe and more efficient to do so at this time.
Dr. Kwak, in the meantime, let's go over to the United States because it seems like vaccinations for children 6 months and older have been recommended by the FDA. So what's your assessment on this? Is it really safe to vaccinate such young children?
Well, I would certainly say that FDA has made their own decision based on a strong proof of safety and efficacy. I believe with our own experiences with vaccination, we observe that it is also quite safe and efficient to vaccinate ourselves. if not just in child age. I believe, despite observing many cases of side effects such as myocarditis and other sorts, I think it's still relatively safe to inject even children with these vaccines, considering how much of a benefit it can provide us in prevention against COVID-19. When FDA has started to recommend vaccinations even younger children that are above 6 months and above, I believe they have looked into data that have accumulated in the past of many of hundreds and thousands of cases. So I think it is okay to follow their recommendation and maybe even consider vaccinating or recommending vaccinations in that much of a younger generations in ourselves as well.
And Doctor, many are now comparing the Omicron variant to a common flu or a light flu, the common cold or a light flu. Do you have actual figures as to how many people get the flu each year and succumb to the flu so that we can make some kind of comparison?
Right, so deaths from influenza actually vary year to year. And back in about 3 years ago, I believe we have tripled the numbers of deaths from influenza compared to many other years. And I believe that ranked at about 750 deaths that year or so. But government is currently referencing 0.05% to 0.1% mortality rate per influenza to be referenced as something we should base on to make our own decision against COVID-19. They're saying that if it was not to exceed double that amount, meaning 0.02% or 0.1% of death rate caused by COVID-19, we could possibly go back to lifting up the mandates for self-quarantine. Now, they have laid out some examples for that, actually. So the weekly numbers or daily death totals from COVID-19 should not exceed 20. We're currently seeing that today, from yesterday, that we've only faced about 10 deaths. And also back in May of time, we had about 0.07% of death rate from COVID-19, which in comparison to that caused by influenza, we were in the category of being very comparable, having death cases from COVID-19. So I think we're headed towards the smooth transitioning to considering the Omicron variant and also COVID-19 to be somewhat manageable, such as in the case of influenza. But we'd have to observe a couple more months or even a little bit more to really feel ourselves safe in the place to do so.
Right, except for the fact that, of course, the flu or the cold doesn't have long-term symptoms that you would kind of see in some COVID-19 patients as well. Nevertheless, Dr. Kwak, thank you very much for your insights again and looking forward to speaking with you.
Thanks for having me.